All right, so again, in the sort of public health setting and in the discussions that we've had this week, we've been talking about human diseases and animal diseases and cultural practices and environmental effects. And there's a concept that has gained a lot of attention in the public health realm recently, that is this idea of the One Health concept, right? Which is to bring together both human and animal and environmental and plant health all together to improve total health rather than necessarily targeting individual pathogens or taking a vertical or a top-down approach. So what I wanted to put out was just a general discussion of how relevant we think this topic is. Is this actually an important concept or philosophy, or is it just a repackaging of old ideas? And are there any examples where the One Health concept has actually led to improved public health outcomes or human health outcomes?
So I think it's very relevant in the current context of West Africa and Ebola. So what we see is a lot of the people living in rural communities are smallholder farmers, farming a diversity of crops, plantain, cassava and cacao. And in the Ivory Coast, which accounts for 41% of the overall cacao crop globally, we see that the movement restrictions across West Africa is having a big effect on the ability of people to sell cacao, and you see actually a concomitant increase in the commodity price. And so that might lead to individuals then saying it's not so profitable, they might move, you might get a greater diaspora, not tending the farms, you might see an increase in Phytophthora infections of cacao and maybe some other associated viruses of the plant, and then you might see something else coming in. So you can see how requiring quarantine or controlment of Ebola is good in one part, but it may have knock-on effects at the farm level, leading to greater movements. And so trying to tie all this together is really crucial, I think, because ultimately you want to satisfy the nutritional needs of people. I think one area where it's being worked on very aggressively and I think very effectively is the Millennium Village projects across Africa, where there's about 33,000 farmers and 15 different ideal locations from Ethiopia to Ghana, where they're trying to focus in on what people need. They need infrastructure, they need electricity, water trapping, fertilizers, better plants, and so on, and education, and trying to work across, and then of course malarial treatment and everything else. Trying to work across all of these different needs, you see the interconnectivity of it. It's not good enough just to provide a laptop to a child, but you have to deworm her so she's ready to learn, for example. And as well as provide better pesticides for her parents, so they don't need the children in the farm doing the farm work. So there's all of these things are really connected. So there's a lot of logical sense. I'm not sure to what extent it's a repackaging of old ideas, but it certainly seems to be a nice, cohesive, holistic view and approach.
Mm-hmm. No, I think it's been very interesting, the idea of these sort of downstream effects of infection, and I mean there's been some really wonderful work done looking at things like schistosomiasis, et cetera, and the downstream economic impacts that oftentimes these things have, because people become ill, they can't work they don't have the same energy, they can't work as hard. That means they start to fall behind on their crops, and they sort of pull themselves into what have been called these poverty traps, that become these sort of self-sustaining cycles, because you now are not producing as much money, you can't invest as much in healthcare, and you can't pull yourself out to start to solve some of these problems, right?
No, I guess, well, certainly relating to the interconnectedness, a big problem now, with probably one of the biggest problem right now with Ebola in West Africa, is perhaps not Ebola, but the complete breakdown in all routine vaccination, pediatricians. There's suddenly there's no healthcare for all the other big problems, like giving birth to healthy babies, saving mothers during delivery, routine vaccination. I don't know. I think you said that routine vaccination.
There certainly, well, there have been some estimates and surveys. Then these are in targeted areas, but in places where we've seen upwards of a 50 to 75% reduction in primary healthcare services, either because people are not coming to clinics, or because the healthcare workers themselves are leaving the clinics, or are afraid, or have been afraid of contracting disease. And so again, these the one disease focused approach leads to perhaps one set of solutions that you might think of, but thinking more broadly and perhaps preparing for the downstream effects could be I think is a as you said, a more holistic way of approaching some of these problems.
I don't think it's a repackaging of old ideas. I mean, certainly in the veterinary community, in the 80s, we moved away from what we called fire engine medicine, going out and treating a disease as it occurred, and recognized that if you're going to treat respiratory disease in a barn, you have to deal with the ventilation issues, right? So you have to know something about construction and air movement, and often all you have to do is get calves outside, and the respiratory, the agents are still present, but you reduce the incidence of disease. And to extend that a bit further, then the basic concepts of that have been talked about really in this course of how disease develops, the ecology aspects, those are very common, certainly in animals and humans. And so the idea of One Health is to bring those common elements together, because things that affect animals also affect humans, and often we have disease seen in animals before we have it seen in humans. And there's obvious examples, and for this, rabies is actually an interesting example there, but there's many, many more.
Yeah.
Can we afford it though? I mean, it just seems to me a daunting task when you want to try to deal with all of the downstream issues at the time.
It's just a more integrated approach in the educational process, right? And I don't think it's insurmountable. But what's insurmountable, of course, is it's academics, and it's always hard to change how we train medical professionals.
Yeah. Well, I mean, I think that question could be turned around and could be asked: can we afford not to
do it?
Can we afford not to think that way? If in fact what we're dealing with is, not just treating this one child, but thinking about food production and economic stability and political stability and lots of these other linked processes that are tied to disease. So from that perspective, that that we're perhaps undercounting the benefits in terms of dollars to expenditures in healthcare.